Presentation on Bone Cancer by Tiffany Breibag. So you may ask yourself, what is bone cancer? Bone cancer is considered an uncommon type of cancer that begins in the bone. Which bone the cancer begins does not matter. Bone cancer may begin in any bone in the body. Arms and legs seem to be more affected. There are several types of bone cancer. Unfortunately, some types of bone cancer targets children. Common forms of bone cancer are osteosarcoma and Ewing tumors. We require our bones to support the framework to our bodies. Most commonly, when a doctor states a patient has bone cancer, it usually is cancer that is spread to the bone from another location. This is known as metastatic cancer. Metastatic cancer is often seen in advanced cancer. These types of tumors are formed of the tissue of where they came from. For example, lung cancer spreading to the bone would be made up of lung tissue. Therefore, the tumor is treated the same as a lung tumor. Another type of cancer that is referred to as bone cancer begins in the blood-forming cells of the bone marrow, not the bone itself. Cancer that starts in the bone marrow is often known as multiple myeloma. Also, leukemia is a form of cancer found in the bone marrow. Occasionally, lymphoma is a form of cancer associated with the lymph nodes, but often it begins in the bone marrow. A bone tumor itself begins in the bone and is referred to as sarcomas. Sarcomas begin in the bone, muscle, fibrous tissues, blood vessels, fat tissue, and occasionally in other tissues. Sarcomas can actually form in any part of the body. Sarcoma is known as the primary or true bone cancer. There are several types of bone cancer, and their names often depend on the area of the bone or the surrounding tissue. Some primary bone tumors are benign, meaning not cancerous, and some are malignant, meaning cancerous. Most of the bone cancers are often sarcomas. So, who's at risk? Bone cancer could be scary for anyone at any age. Approximately 3,000 cases of bone cancer are diagnosed in the United States each year. Since primary bone cancer is uncommon, it makes up less than 0.2% of all cancers. Young adults and children are diagnosed more with bone cancer compared to older adults. Some risk factors include previous radiation therapy treatment, previous chemotherapy pharmacological treatments, mutation in the gene known as retinoblastoma, and some associated conditions such as hereditary retinoblastoma, Paget's disease of the bone, Li-Fraumeni disease, and Diamond-Blackfan anemia. Specifically, Paget's disease of the bone is a precancerous condition that increases the risk of bone cancer in older adults. So you may be asking yourself, what causes bone cancer? There is no exact answer when discussing what causes bone cancer. What is known is that bone cancer begins as an error in the cell's DNA. This error causes the cells to grow and divide in an outrageous way. These cells do not die at a normal rate, they continue to stay alive. These mutated cells accumulate and form a mass known as the tumor. Generally, cancers form when the pathways disrupt normal cell growth and proliferation. This allows for the abnormal cell division and growth. Common types of bone cancer. Bone cancer is often categorized by the type of cell and where it begins. Most common are osteosarcoma, chondrosarcoma, and Ewing sarcoma. Osteosarcoma begins in the bone cells. This form of bone cancer is most often seen in children and young adults. This is seen more often in ages 10 to 30 years. This is the most common type of primary bone cancer. Approximately 10% of osteosarcomas develop adults in their 60s and 70s. This form is seen to be fairly rare in middle-aged adults. Males are at higher risk than females for osteosarcoma. Chondrosarcoma is a cancer of the cartilage cells. This is the second most common primary bone cancer. Risk of chondrosarcoma is often seen in ages 20 to 75. Females are at higher risk than males. Chondrosarcoma may develop in any area of the cartilage. Benign tumors associated with chondrosarcoma is more common than malignant tumors. These benign tumors are referred to as endocarcinoma, osteocarcinoma. Chondrosarcoma is further classified by grade, which is influenced by how fast the tumor grows. The lower the grade, then the slower the cancer is growing. Ewing tumor is the third most common form of primary cancer. This is also the second most common form seen in children, adolescents, and young adults. The pelvis, chest wall, and long bones, such as the legs or arms, are the most common locations for an Ewing tumor. Ewing tumor develops in the bone, but it may also begin in other tissues and organs. This form is rarely found in adults over the age of 30. Ewing tumors are often seen more in Caucasians and are very rare among African Americans and Asian Americans. How do you know when you have bone cancer? What are some signs and symptoms? Pain is the most common symptom of bone cancer. The pain appears at certain times. Most often, the pain arises at night and upon physical activity. The pain may even be present for years before an individual seeks treatment. Some cases may have been diagnosed incidentally through radiology imaging tests. On occasion, a mass, lump, or swelling is felt at the site of the bone cancer. Due to weakness of the bone, fractures may also occur. Other symptoms include numbness, tingling, tenderness, or decreased blood flow. Compression of the nerves and blood vessels of the affected area are some less common symptoms. Fatigue and unintended weight loss are symptoms that may also be associated with primary bone cancer. Diagnosing bone cancer. An individual's personal and family medical history is vital to the assessment and diagnosing process. Next, the physician performs a physical assessment, laboratory tests, and other diagnostic tests. Some of these tests include X-rays, biopsies, and blood work. X-rays are helpful to show the location, size, and shape of the bone tumor. From these tests, the doctors can recommend more specific imaging tests. A bone scan may be ordered where a small amount of radioactive material is then injected into the blood vessels into the bloodstream. A computed tomography scan, known as a CT scan, provides a series of detailed pictures of inside the body. CT scans offer images from different angles. A positron emission tomography, known as a PET scan, also injects a small amount of radioactive material known as glucose into the vein. Since cancer cells use more glucose compared to normal cells, this scan may assist to find cancerous cells within the body. A magnetic resonance imaging, known as an MRI procedure, also provides detailed pictures of inside the body without the use of X-rays. An angiogram may also be ordered. An angiogram is an X-ray of the blood vessels. Biopsy is a major step in diagnosing bone cancer. A biopsy is in the removal of the sample of tissue formed in the tumor. This is done through a surgical procedure. This sample is then examined by a pathologist to determine whether the tumor is cancerous. Blood tests are also performed to examine the level of an enzyme known as alkaline phosphatase. A large amount of this enzyme is present when the cells associated with bone tissue are very active. This test may not be completely reliable due to the increased levels also seen in growing children and in mending broken bones. So what are some treatment options? Treatment options are influenced by the type, size, location, stage of the cancer, the age of the individual, and the general health of the patient. Surgery, chemotherapy, radiation therapy, and cryosurgery are often used. Surgery is the most common treatment for bone cancer. The surgeon removes the entire tumor along with its negative margins. As medicine and surgical procedures evolve, dramatic improvements have been seen in surgical techniques and preoperative tumor treatments. Chemotherapy is a form of anti-cancer drugs used to kill the cancerous cells. Currently, chemotherapy is not used to treat chondrosarcoma. Radiation therapy is a form of therapy where high-energy X-rays are used to kill cancerous cells. This treatment is often used in combination with surgery. Cryosurgery is a treatment option where the liquid nitrogen is used to freeze and kill cancerous cells. On occasion, amputation is considered. Since bone cancer may come back, follow-up is vital. Ewing sarcomas specifically do not respond well to treatment options, and often chemotherapy is followed by stem cell transplant. In stem cell transplant, the patient's own stem cells are harvested from the bloodstream to later be returned to the body after high doses of chemotherapy. Managing the pain. Analgesics are pain-relieving medications often used to manage the pain of patients with bone cancer. Mild to moderate pain is often managed with acetaminophen or non-steroidal anti-inflammatory medications known as NSAIDs. However, patients with chemotherapy should avoid NSAIDs due to the risk of bleeding. For moderate to severe pain, opiates are used. Common opiates are codeine, morphine, oxycodone, hydromorphone, and fentanyl. Often a combination of medications need to be used. Prognosis. The prognosis refers to the outlook. This truly depends on the type of cancer and the extent of which it has spread. The overall 5-year survival rate for all bone cancer patients is approximately 70%. Most specifically, chondrosarcomas in adults are approximately 80% for their overall 5-year survival rate. When the cancer has metastasized, the survival rate is about 15 to 30%. Younger individuals and females most often have a more favorable prognosis when compared with males or other adults. Follow-up treatment. Bone cancer may metastasize. Seeing the doctor regularly is vital to a patient diagnosed with bone cancer. Frequent blood work and X-rays are expected. Patients with bone cancer are also at an increased risk to develop other forms of cancer later in life. Clinical trials. Just as in any problem needing to be solved, clinical trials are done to continue to advance and evolve. New treatments along with better ways to manage current treatments advance the knowledge gained from clinical trials. The National Institutes of Health sponsor and regulate clinical trials. Individuals interested in clinical trials should speak with their doctor and contact the National Cancer Institute for further information. Coping and support. The diagnosis of cancer is extremely overwhelming. It may seem difficult to cope with the distress and uncertainty of cancer. Some important steps would be to educate yourself and communicate with your doctor. As an individual learns more, they tend to become more confident regarding their options. Family and friends are very important. Keeping a close, strong relationship is vital. They may provide physical or emotional support. Finding someone who is a good listener is also very important. A counselor, medical social worker, clergy member, or a cancer support group are helpful thoughts throughout this entire difficult process.